Hi friends, I am Dr. Pratap Singh Rathore. I have done the MD in Forest Medicine. And today we'll continue with thermal injuries. And today we'll discuss about general effect of heat, that is hypothermia. Hypothermia is a acute condition which occurs when the body absorbs more heat than it can dissipate. So it occurs mainly when body is exposed to exposure to excessive heat. In that, when the body's heat regulating mechanism of the body eventually becomes overwhelmed, unable to effectively deal with the heat, and the body temperature climbs uncontrollably. So when the person is exposed to extreme heat, and when the person's heat regulating system doesn't cannot control the heat, then a person goes into acute condition of hypothermia. So mainly, if the body temperature above 40 degrees centigrade reaches, so it is core temperature or rectal temperature, if it reaches more than 40 degrees centigrade, it becomes life-threatening condition. At 41 degrees centigrade, brain death occurs, and at 45 degrees centigrade, death is nearly certain. Internal temperature above 50 degrees centigrade, when the muscles starts getting rigid because of coagulations, and immediate death occurs. So usually, if the body core temperature has to be regulated, and if the core temperature, not the environmental temperature, it has to be kept in mind. When the core temperature reaches more than 40 degrees centigrade, the body damage starts to appear. Causes of hypothermia, mainly they can be divided into as a natural cause. Mainly, person when is exposed to excessive heat by sun rays. Mainly in summer is summer where the elevated temperature may reach up to 45 degrees centigrade, and the person is excessively working in the hot sun. He may get hypothermia injuries because of hypothermia. Also seen in certain conditions like where they work in manufacturing buildings or miners because of excessive exposure to heat by sun. Artificial sources such as industrial furnaces in factories where the person is exposed to extreme heat in furnaces or huge baking oven, they also can get hypothermia. Or the person is present in a poorly ventilated room, closed rooms, or factory or mines where the temperature is high but air is moist. Because of that, hypothermia also can result. The condition mainly results from because of high temperature, environment temperature in hypothermia. One is heat cramps, where there is no rise in body temperature, heat prostration or heat exhaustion or heat syncope, where body temperature is subnormal, and heat hyperpyrexia, where rectal temperature may reach above 41 degrees centigrade. Coming to one by one, heat cramps, also known as minus cramps, strokers cramps, or fireman's cramps, where these are common miners seen in miners where they work in a heavy in a closed environment and in this exposure to sun where they get increased sweating, and because of that heat cramps occurs. They are result mainly because of fluid and electrolyte depletion. So whenever they work in the hot environment, because of increased sweating, they lose most of the electrolyte, and because of fluid and electrolyte loss, they go for heat cramps. It usually occurs in workers in high temperature when sweating has been profuse. Cramping results from dilutional hypothermia. There is also a history of vigorous activity just preceding the onset of symptoms. Clinical features: onset is very sudden. There is severe painful paroxysmal skeletal muscle contractions. There is cramps. Severe muscle spasms may last up to 1 to 3 minutes. Some muscles, usually skeletal muscle, starts getting contracting. Severe contractions and spasms, which are mainly seen in the mostly used arms, like arms, legs, and abdomen muscles usually gets cramped up. Involved muscles may get tender and hard and lumpy because of contracted contractions. Face is flushed, pupils are dilated, and patient may complain of dizziness, tinnitus, or headache and vomiting. Skin is moist and full because of increased sweating. The temperature is normal, but because of increased loss of electrolytes and fluids, the person has heat cramps. Body temperature may be normal, slightly increased. Treatment in heat cramps: patient should be moved in a cool environment and given oral rehydration solution to replace both salt and water, and otherwise rest for 1 to 2 hours, 1 to 3 days. Next condition is heat exhaustion, where there is subnormal body temperature. It results from prolonged strenuous activity with any inadequate water or salt intake in a hot environment and is characterized by dehydration, sodium depletion, or isotonic fluid loss with accompanying cardiovascular changes. So heat exhaustion is associated with cardiovascular changes where the person, because of loss of fluids, loss of electrolytes, loss of sodium, and dehydration, goes into heat exhaustion. Symptoms associated with heat syncope and heat cramps may be present. So other conditions like heat syncope and heat cramps may have symptoms associated with them coincide with heat exhaustion. Clinical features include nausea, vomiting, malaise, myalgia where muscle pain is there, weakness is present. Patient may become quite thirsty and weak with sinus symptoms such as headache, dizziness, fatigue, anxiety, paresthesias, impaired judgment, hysteria, and occasional psychosis. Mainly because of loss of fluids, the serious symptoms may occur. Heat exhaustion may progress to heat stroke, where body temperature rises more than normal and go for hyperpyrexia, heat stroke. Diagnosis can be done by prolonged symptoms like more than temperature of more than 37 degrees centigrade, 37.8 degrees centigrade, with increased pulse and moist skin is a condition can be associated with heat exhaustion. Treatment patient is treated and should be kept in a cool environment, adequate hydration, about 1 to 2 liters for 22 to 4 hours, oral salt replacement and active cooling like fan or ice bathing should be, if necessary, should be done. Normal saline or alcoholic glucose solution should be administered IV if necessary. Next condition is heat prostration or heat syncope or collapse. This is similar to heat exhaustion, but here the main symptoms are mainly because of cerebral hypertension results because of condition mainly because of CNS symptoms, CNS condition it occurs. It results from salt depletion and dehydration due to excessive sweating and cutaneous vasodilatation with consequence systemic and cerebral hypotension, but without any rise of temperature despite exposure to excessive. Even though the person is exposed to excessive heat, there is loss of salt, dehydration, excessive sweating, and there is systemic and cerebral hypertension occurs. The condition is usually seen in tropics and in desert areas. Percentage factors includes overexertion, heavy muscular work, and use of unsuitable clothing in the environment of excessive heat. If it is wearing closed clothing, there is chances are predisposed to heat syncope. Clinical features includes person suddenly feels weak, giddy, and sick. There may be nausea, dizziness, flushing of face, throbbing headache in temples, and dizziness in vision occurs. Face is pale, pulse is weak and feeble, respiration is sighing, skin cool and moist, and temperature is subnormal, normal to subnormal. Systolic BP usually becomes less than 100 mm of Hg. So mainly there is decrease in blood reaching the organs leading to cerebral hyperperfusion. Treatment consists of rest and recommends in the cool pace and rehydration by mouth or IV if necessary. Next serious condition is heat hypoxia, heat stroke. So any person who has heat cramps or heat exhaustion, heat prostration can go into hyperxia, heat stroke, where if he continues to work in the same environment or if the predisposing factors continues to work, the person may go for heat hyperxia, heat stroke, which is a serious condition. It is a life-threatening and emergency condition resulting in failure of the thermoregulative mechanisms. So it results mainly because thermoregulative mechanism of body fails to compensate the excessive heat and cannot maintain the body temperature. It is characterized by cerebral dysfunction with impaired consciousness, high fever, that is core temperature, that is rectal temperature may reach more than 41 degrees centigrade, and there is absence of sweating. Sometimes a term thermic fever is used when if the heat hypoxia has result because of exposure to sun. It presents one of the two forms, like classic seen in patients with compromised hemostatic mechanisms or exertional, where the healthy persons undergoing strenuous exertion in a thermally stressful environment. So it may occur classically where the person, because of loss of hemostatic mechanism or thermoregulative mechanism fails, may a person goes for hyperpyrexia, or the person is already working in thermally stressful environment and he because of increased exertion he goes into heat stroke or heat hyperxia. Reducing factors, one is environmental and non-environmental conditions. Now environmental mainly because of high temperature, increased humidity, lack of acclimatization and physical exertion. So increased working, increased high temperature all predisposed to heat hyperxia. Non-environmental causes like extremes of age, if the person is infant or elderly, other conditions like obesity, alcoholism, brain hemorrhage, malignant hypothermia, chronic infirmity where the person is chronically ill, underlying any medical conditions like thyrotoxicosis, sepsis, where already body temperature is in rise, cyanide overdoses, where again it diminishes regulatory mechanism. Patients receiving medications like anticholinergics, antihistamines, or phenytoxins, where again the body temperature, body's heat regulatory mechanisms are decreased because of the drugs, and reaction certain drugs like abuse such as cocaine can also cause heat hypoxia. And if he is already certain using these types of drugs and exposed to excessive heat in the environment, may go for heat hypoxia. Clinical features: onset is sudden with sudden collapse and loss of consciousness. Prodromal symptoms like dizziness, weakness, nausea, vomiting, confusion, faintness, staggering weight, purposeless movements, disorientation, drowsiness, and irritation behavior occurs. Skin is hot, initially covered with perspiration, later it dries off because of loss of thermometric mechanism. Person is sweating is stopped and it gets drying up. Later on, there is tachycardia and hyperventilation with subsequent respiratory alkalosis because of increased accumulation of carbon dioxide. Then there is blood pressure may be elevated in early stages, but later hypertension develops. Core temperature is usually more than 40 degrees centigrade. Pupils are contracted. There is delirium, blurred vision, convulsions, collapse, unconsciousness, and even death results from cerebral or cardiovascular and renal damage. So mainly the organ function starts diminishing and stops working, and person dies because of multi-organ failure. Treatment: immediate measures has to be taken to compensate hyperpexia. Patient is unclothed to minimum and sprayed with water while air is passed across the patient's body so that body temperature decreases. Immersion in ice cold water is very effective. Treatment should be continued until the body temperature drops to 39 degrees centigrade. Drugs like chlorpromazine or diazepam should be given every 4 hours to control shivering. Fluid administration to ensure high urinary output more than 50 ml hours should be present. Mannitol administration and alkalization of urine should be done, also recommended to treat the hyperpyrexia. Complications: if the patient survive more than 24 hours or because of heat hyperpexia, since it can damage organs, complications arises because of hyperpexia, like lobar pneumonia, infection in the lungs, tubular necrosis of kidneys, hepatic necrosis, necrosis that is mainly the part of the cells, part of the tissue gets necrosed because of lack of blood required, myocardial fiber necrosis, disseminated intravascular coagulation, that is coagulation throughout the body, adrenal hemorrhage, and myoglobinuria due to rhabdomyolysis can also are complications of heat hypoxia. Now coming to postmortem findings in hypothermia, death-related hypothermia has no specific autopsy findings, only mainly based on the history and situational where the body is formed. It can be listed as a cause of death in case of death because of increased temperature. Specific findings like post-mortem curiosity, that is body temperature is higher even after the death. So body temperature instead of cooling, usually there is a post-mortem cooling occurs after the person dies, but in these cases the body is it is not observed, there is increasing body temperature. Eyes, there is spitting and sinking of eyeballs usually seen, which could mimic the evolution of eyeballs. Rigor mortis sets early and passes off early. So rigor mortis, which is contraction of muscles which occurs about 6 to 12 hours, it early starts early by 2 to 3 hours and also passes off early. Postmortem stains, which are seen in the different parts of the bodies, are marked on account of greater fluidity of blood. Putrefaction is also starts rapidly in case of death because of heat hyperpexia. Lungs is congested. There is intrathoracic petechius may be present. In heart, there is endocardial hemorrhages may be seen. Brain may be congested edematous. Convergence on the brain gets flattened up. There is marked changes in cerebellum, including necrosis of Purkinje cells and the marked decrease in number of Purkinje cells because of decreased blood hyperpopulation of tissues. Now coming to medical importance of hypothermia. Hypothermia can be created artificially by drugs, which is also called as thermotherapy. It may be used in certain. It is used in certain cancer treatment to kill or weaken tumor cells with negative effect on the healthy cells. This can also be interpreted as a cause of death where body temperature is in at rise. Magnetic hypothermia is a rare condition where the body temperature rises because of general anesthesia. Death due to hypothermia is usually accidental, as observed in dry humid conditions. It may be suicidal or homicidal. Unfavorable working conditions of at industry unit may where the person is working in the factory conditions, and if he has some accident with heat type heat stroke or heat cramps in that conditions, he may attract workman compensation act. He may claims for compensation from because of compensation act. Murder by administration of mixture of belladonna, atropine, and possibly cocaine stimulating heat hypoplexy. So sometimes giving drugs may also stimulate like certain poisons may stimulate like hypoplexia, which may the person might be died because of that, and which may confuse that he has died because of natural conditions. In case of sunstroke, patients may pass into stage of suspended animation, and which case the person may be resuscitated, and person should not be pronounced dead before completely examining the person's doing ECG and EEG. And if the person is in suspended animation, he has to be revived or resuscitated measures should be taken. These are my references. Thank you.